Good, happy Tuesday morning, November 17, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday morning, so let's begin. First up, we're going to begin with your COVID-19 updates. First up, there are 358 new positive cases of COVID-19 announced in New Hampshire. One additional death. Daily PCR test rate is 4.3%. November has brought new highs in COVID-19 infections in New Hampshire, with numbers expected to climb as the holiday season begins. On Monday, health officials announced 358 new positive test results for COVID-19 in the state. The results included 193 people who tested positive by PCR test and 165 who tested positive by antigen test. With daily test positivity rate of 4.3%, there are now 3,344 active cases. There were 5 new hospitalizations and 1 additional death linked to long-term care facility. A man who died was a resident from Coats County and was 60 years of age and older. Health officials said most of the hospitalizations involve an older population, but they stressed young people or people who are otherwise healthy can still have serious complications. We're having an increased number of reports coming in from scientific literature of potential long-term complications from COVID-19 infections that can include heart and lung problems. State epidemiologist Dr. Benjamin Chan said, "So we want everyone to take this seriously because anybody can become affected and anybody can spread it." And now let's take a look at coronavirus in New Hampshire, key information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 15,029 number of people in New Hampshire have tested positive for COVID-19. 11,172,779 number of people in the United States have tested positive. 500 number of deaths from COVID-19 in New Hampshire. 817 number of people have been hospitalized with COVID-19 in New Hampshire, and 247,019 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Nashua, 352. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 1,600. And now let's take a look at the 3 charts here. Let's start with the first chart here. New cases each day in New Hampshire. The purple daily new positive COVID-19 cases, orange new hospitalization, and red deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases, and in the orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases, in the orange, total hospitalization, red deaths, and blue recovered. Let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases. female and male of cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percentage of population, race/ethnicity of cases, and hospitalizations. And your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Community spread impacting workforce, including hospital staff cases originating from outside of workplace. Let's take a listen to that video from WMUR News 9, Jennifer Crompton.
At Honda, we take the holidays seriously. With serious stuff.
Community spread is being felt at hospitals like Portsmouth Regional. Daily cases in its emergency department quadrupling recently.
What's not totally transitioning is into the hospital, which is a good thing. And so people are being discharged, not having to have an inpatient admission. But those are on the rise as well.
A concern as staff cases rise too.
In October, we had 2 employees come back positive. In November, we've had 1 per day.
Only 1 acquired at work. 15 now isolating, plus those in quarantine because of positive family members.
If we keep at this pace, and you start to think about the downstream effect of that, you may have a bed, your bed's going to end up blocked because you don't have the right patient-to-nurse ratio that you need. So that's the concern on the other side.
Another reason to fight COVID fatigue and follow guidelines, according to the state epidemiologist.
We still believe the healthcare setting, hospitals, doctors' offices can and continue to operate safely. But anybody can pick up COVID-19 in the community, especially as transmission increases, and so that's going to increase the risk to hospitals and provider offices, long-term care facilities.
We apologize for any confusion at the top of that story. Meantime, the CEO points out that we're all likely fighting to keep up the stamina while we want to spend time and engage with family and friends. This, though, a reminder that when we do so, we could be impacting workers that help keep their community safe. Live in Portsmouth, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Manchester School District to be fully remote from November 23rd through January 19th. Move made as COVID-19 cases rise. Let's take a listen to that video from WMUR News 9.
For supporting our team.
And we do have breaking news tonight. The Manchester School District will switch from hybrid to fully remote learning starting Monday. The school board just voted to go fully remote through at least January 19th. Now, if Manchester's COVID-19 metrics are still in the red at that point, schools will stay remote until the metrics improve.
I have to anticipate it's going to be a rough December in particular. And I think we just have to plan accordingly. And unfortunately, this is something that is playing out literally day by day. And we have to just monitor that data, be data-driven, be evidence-driven.
There will be exceptions for EL students and students with special needs.
Okay, and there you go on that video and that report. New Hampshire House Republicans plan return to in-person committee work, legislating at State House. HVAC system being evaluated. Let's take a listen to that video from WMUR News 9, Adam Sexton.
At Honda, we take the holidays seriously. With serious style.
In a normal year, the first few months of a new legislative session in Concord could qualify as some of the least socially distanced large public gatherings in the state. People squash themselves into committee rooms for seemingly endless hearings. Up to 400 are seated elbow to elbow all day long in Reps Hall. It's not the best setup to prevent the spread of COVID-19, and that's why committees now meet online. The House has taken up residence at the Whittemore Center at UNH, and the Senate moved into the House chambers.
Our staff has done a study of Reps Hall. The most people we could put in Representatives Hall would be 88 people with appropriate spacing and everything else.
With Republicans reclaiming majorities under the Golden Dome, Speaker Steve Shurtleff is raising concern about an expedited return to in-person committee work and legislating at the State House.
I've met with Leader Hinch in a couple of meetings in the last month or so. He said his goal is to go back to Reps Hall as soon as possible. And I'm concerned. I'm concerned by the fact that the average age of a state rep is 63, and I worry about our members and our staff.
House Republican leader and candidate for Speaker Dick Hinch tells News 9 he does want to get back to as much in-person work as possible, but only if and when it's safe.
We're evaluating the HVAC system, and we have someone that is going to help us navigate through that so that we can reoccupy the Legislative Office building.
An added dimension here is the House Freedom Caucus, which appears to have grown its ranks during the last election. Many of those members refused to wear masks during the sessions at the Whittemore Center, and they're unlikely to budge from that position moving forward, making an eventual return to the State House more complicated.
I think the choice not to wear a mask should be accommodated. I don't know how that's going to play out. I mean, the gallery is really for the people to sit and watch, but maybe a section of the gallery.
In Concord, Adam Sexton, WMUR, News 9.
Okay, and there you go on that video and that report. State COVID-19 positivity rate now at 4.3%, 18% of the cases from community spread. Health officials urge vigilance. Let's take a listen to that video from WMUR News 9, Tim Callery.
At Honda, we take the holidays seriously. With serious style.
We are still seeing the numbers increase.
State health officials say COVID-19 community spread is now common. According to today's numbers, 18% of people who contracted the virus in New Hampshire got it through the community. Manchester and Nashua make up 21% of the state's total infections.
Every county within our state, including the cities of Manchester and Nashua, continue to be at a substantial level of community transmission.
Community transmission has also contributed to 31% of hospitalizations.
We continue to see the number of hospitalizations slowly increase. The PCR test positivity rate is also increasing.
On average, around 9,000 tests are being reported each day. People aged 20 to 29 have the most cases, with 18% of the state's infections. DHHS says while young people tend to have the least impact from symptoms, the dangers of the virus still remain.
We're having increasing numbers of reports coming in from scientific literature on potential long-term complications from COVID-19 infection that can include heart and lung problems even. So we want everybody to take this seriously because we know that anybody can become infected, anybody can spread it.
And tonight, 74 people are hospitalized with COVID-19. That's the highest number the state has seen since June 12th. Reporting live, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.